It's Breast Cancer Awareness Month and it didn't slide past me. I wanted to make sure that I do something special for it. But I wanted it to be less clinical and more human. So I reached out to Michele D, who tells the most human of stories and doesn't sugarcoat it when it comes to her experience with breast cancer, the whole journey from start to finish and coming out the other side of it. I took a lot away from my conversation with Michele, and I hope that you get the opportunity to as well. And I wish everybody that's in that boat the same happiness and success that Michele has coming out the other side of it. Enjoy. Today I'm going to talk to Dr. Michele Clarke, and Michele has a really unique and interesting backstory that has turned into, shall I say, blossomed into something fantastic. But I'm going to let her tell the story. This specific episode is going to be exclusively for Breast Cancer Awareness Month. We focused on it specifically, and Michele is going to tell her story about how she's been affected by breast cancer. So if you don't mind, Michele, if you're okay, could you share your personal journey?
Absolutely. And thank you so much, Jennifer, for having me on Lighting It Up. I'm super excited to be here today.
Excited to have you.
Thank you. Yes, for those of you all who don't know me, my name is Dr. Michele D. Clarke. And, just to start off, I'm just a small town girl with big time dreams who God has definitely shown his grace and his mercy. He saved me from definitely a lot of life threatening things. And one of those things is stage 2 breast cancer. And so my journey started out a little weird, Jennifer, to be honest with you. Well, first of all, I was just recovering from 2 strokes. So let's get that right.
Yeah.
But before I had the 2 strokes, I actually had some weird symptoms that no one would really relate to breast cancer.
What were they?
Yes. So I had this weird vibrating sensation on my right breast.
Okay,
So I'm about to date myself real quick, y'all. You remember pagers. So if you were to put like a pager or some kind of vibrating apparatus like a phone into your bra, and then you feel this vibrating sensation, like, what is this? Now, I didn't do either of those things. I didn't put any phones or pagers or anything in that area. So it wasn't like had any correlation. And it would happen intermittently. So it wasn't like ongoing. And being busy as us as high achieving, high performing women are, you just kind of blow it off and say, okay, that was something that was weird, and then just keep it moving. Well, it started happening like intermittently, like I stated, and it was just like, okay, you know what? This is weird. I should probably go get it checked out. So I went to go get it checked out, and they actually found something abnormal on my left side. It's like, what is that? The only thing I can surmise from that, Jennifer, in retrospect, is that my right side was like, buzz, hey, y'all need to take a look at the left. She ain't right.
Praying for attention. Have you ever met anybody else that's felt the same thing?
I have never, ever met anybody who has had that symptom.
It's unusual, but it got to the point, I guess. So like you say, it did get your attention.
Yes, it most certainly did, because it just was abnormal. It was unusual. But before, Jennifer, I could get back in to get it checked out further, that's when I had the 2 strokes. So we're talking now, fast forwarding almost a year later when I go back in. So a year later, I go back in. They did find calcification clusters. And so at that point though, so that was back when they found abnormalities on the left side. So when I went back in that year later, they biopsied me and they said, we'll let you know, we'll give you a call. And so, okay. And so one day I'm at work, Jennifer, and I'm sitting at my desk. I get a phone call, ring, 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 ring. It's from my primary doctor. He's like, hey, Michele. I was like, hey, doc, what's going on? He was like, no, you have breast cancer, right?
What?
Yeah, that was my introduction to learning that I had breast cancer.
Did he think? Obviously, he was asking the question. He thought that you knew, but even if you knew, that's still a weird way to approach it, isn't it?
100%. I only can surmise that he thought that maybe the pathology department or oncology department. Someone may have called me in advance, but like you said, yeah, absolutely. You still want to tread lightly.
Mm,
And personally, myself, I would have asked for the client to come in.
yes.
I would have been like, let's set up an appointment.
Yeah.
And then, we'll discuss everything in depth and get the soonest appointment possible on the books. On schedule, oh, okay, I'll see you in a month. No, like I want to see you like tomorrow. And so that way the person isn't worrying all those days. Like, what is the doctor going to say? Can you just tell me over the phone? Well, no, I think it's something we need to talk about in person.
So what did
But
you
I did get
do
that
when he
option.
told you, like,
Yes, just kind of, but you know what, Jennifer, it was kind of the rip the Band-Aid off experience. And I can only, hindsight is 2020. So now I can just kind of sit where I am now and say, well, maybe that's how I needed to hear it because I was at work. I was in between clients. And so it did give me the opportunity to get very emotional.
yeah.
I stayed very cerebral because it really was a rip the Band-Aid off. And so I was just like, okay, doc, well, nope, didn't, but what do we do now? And just kind of swung into that. Something my mom has always taught me that, you identify the problem, but you don't sit there. You now move to solution mode. And so that was my next question. What do we do
What
now?
what a fantastic reaction in the moment to instinctively go to what can we do, as opposed to there's so many other places that your mind could have gone. Kudos to you for that.
Thank you. Thank you. Appreciate it. And I received the kudos, but good Lord, I just don't know. I'm so happy and grateful that you have my Lord and Savior because I just don't know. I don't know how I would have reacted. I don't know where I would be right now without God. Just put it like that. So,
So when you found out, then what was the plan from that stage then?
yes. So I went in, and at the time, they told me that I had to have a mastectomy of the left side. They couldn't spare anything, nipple, skin, nothing. They had to take it all. They
Wow.
also gave me the option to do bilateral. In other words, to get rid of or mastectomy the other side. That was the non-cancerous side for preventive measures. At that point, I wanted to get a second opinion. So I went to a different health system and got a second opinion. And the result was the same, that I had to have a mastectomy. And I just want to say, I remember both of those dates, the date that I received the first news and the date that I went um, for my second opinion. I got those results. The first date was September 25th. The second date was November 14th. I remember those dates because both of those dates are my sister's birthdays.
No way.
Yes, my older sister is September 25th. My younger sister is November 14th.
Wow. What a way to taint birthdays. Wow. And then when you had been told by two people then that a mastectomy is the way to go forward, how do you get your head around that? I want to say electively choosing to remove, but you're like the cancer is telling you really, as opposed to you electively choose. How do you get your head around a decision like that where you're going to physically change so significantly?
It's a lot. It's a lot to take in. It's a lot to unpack and uncover and then kind of sort through. So, like when I'm working with clients, I tell them once we've identified the challenge, the issue, let's put it all out on the table. In other words, let's just sort it all out on the table. And then that way we know exactly what we're looking at and we know what we're looking for. We can identify what do we want the end result to look like. Now we
Yeah.
can start fitting the pieces together, casting out the ones that may not fit, maybe finding another pieces and put some in that need to be there. But at the end of the day, it was a lot to unpack. And I did have to discuss with the medical team, the professional team. I had to discuss it with my family. I had to discuss it, with my pastor. So there was a lot of discussions that happened and a lot of internal discussions because at the end of the day, when it's all said and done and the dust clears, the decision is mine to be made. No
Yeah.
one can make that decision for me. Although I promise you, Jennifer, I was hoping somebody could make it for me. Actually, it was just like, well, what would you do?
Yeah.
Well, what would you recommend me do? If, talking with the medical team, if I was your sister, what would you tell me to do? So
Gotta
kind
be
of trying
easy.
to ease and just kind of pull it out of somebody else.
Yeah.
But again, at the end of the day,
You have to
they
live with it.
say, what do you decide?
Yeah.
And what I decided was for a unilateral mastectomy. I wanted to focus on the side that was the challenge, that
Mm.
had the dis-ease. And that's what we did. And so we did the mastectomy, and just taking it back a little bit, we talk about the emotional part of it. So back when I was a teenager and a little before preteen, you know how we start all going through puberty. And at the time, I started budding, and I was 12 years old, and that's about where I stopped. I didn't have a lot of growth. And because of that, unfortunately, I got teased a lot. So I know I've heard it on both perspectives when I talk to women who are very well endowed, and I
Yeah.
talk to women who may not be as voluptuous. I was on that side, and being African American female, we are stereotypically categorized as being curvaceous and voluptuous, right?
Yeah.
Nope. Thanks for playing. That was not my experience. I didn't
Mm.
have that experience. I was very much so on the boyish side that kind of paralleled me being a tomboy, and that's kind of where I sat. Well, again, I was teased a lot because of the fact that I did not have that endowment in those feminine areas. And I therefore internalized feeling less feminine, feeling insecure, having body image issues because of that. So, fast forward, talking about some um, years later, decades later, even, and after undergoing mental health therapy for that and some other challenges, the traumas that I experienced. Unfortunately, I do have a history of complex traumas. And so I felt like, okay, I have a better grasp on my body image. I feel more confident about where I am and how I walk.
Yeah.
And then boom, I get hit with this right after healing up from two strokes where I could not walk, I could not talk, I could not use my whole right side.
I didn't realize that when you talk about the strokes, I don't know why I was kind of going, oh, they can't have been that big because she's flying it. Like flying it is how we in Ireland we refer to things as doing great. Like you're doing fantastic. It never even occurred to me for a minute that that had impacted you significantly because there's absolutely zero science of that now. Was there a lot of therapy to recover from those?
Not at all. Not at all. And that's what I'm telling you, Jennifer. I'm starting to feel like I'm titanium, like I can't be shot down, right? And and no, I didn't have to do any within less than 24 hours. God healed me up and made me new where nobody, if I didn't share what happened, they would never know. No one would ever know that I couldn't talk at all, no speech. When the speech came back, they called it word salad, where I was mixing up. I wanted to
Yeah.
say EMS and I was saying police, so it was just that kind of thing. And then it gradually came back. My whole right side couldn't use it. It was so cold, Jennifer. I promise you, I thought that I would never be able to use it again, ever. And it came back. And here I am.
Oh.
So, right. So just coming off of that,
Mm-hmm.
and now hearing this word, getting hit in the gut, you have breast cancer, right?
Yeah.
Now what? Mastectomy. OMG. So I'm going to lose my girl. And here's the irony of it all. You know how our bodies are not fully symmetric,
Yeah.
right? So my left side actually happens to be my larger side.
Oh, it's just not fair. Like on a scale of not fair, it's way up there.
It's like, I don't know if you remember the game Pressure Luck, but it's like whammy, no whammy, whammy, no whammy. Something like, it's like a double whammy. It's just literally like, oh, okay, okay, guy, what's going on? You know, this can't be like, you can't make this stuff up.
Yeah.
So yes, I did have to have the mastectomy on the left side, which was my larger side, and so I was flat. And unfortunately, some of the life-saving medications. Well, before I even get to that, I wanted to have a reconstruct. I already knew when they said that I had the mastectomy, had to have the mastectomy, that I was going to have to, that I wanted to
Yeah.
reconstruct and rebuild and build back better, right? my mind. I was like, you know what, cancer owes me. I'm gonna get an upgrade. You know, it's
Why
fair,
not?
right?
Yeah.
So here's the challenge. So they had to wait for me to get so far out from the strokes because I still was on medications, blood thinners at that,
Yeah, of
that
course.
was helping to sustain me. So they didn't want to do surgery while I was still on blood thinners. So I had to wait. So right before I was about to get cleared, one of the medications that I was taking to keep the cancer away ignited or triggered a mini stroke.
No way.
Yeah.
So how long do you have to wait after having a stroke before you can have surgery?
And you know, I don't know if it's a concrete time frame. I just know for me, they wanted me to wait at least a year out,
Wow, that's such a
6 months
long
to a
time.
year. So they wanted me to wait 6 months to a year, but I already was more than 6 months out. I
Yeah.
actually was more than a year out.
And
But because I still was on the medication,
mm,
they wanted me to be stable because the reason I had the strokes was because of a spontaneous dissection of my left carotid artery in my neck, meaning that for no apparent reason, the left carotid artery in my neck spontaneously tore.
wow.
It's tore. And I literally am a miracle sitting here. Because when you talk
Yeah.
about anything in the neck, you talk about anything carotid, talk about anything tearing,
It's over
it's usually
quickly, like,
cancer,
yeah, yeah. And that's a
you know?
big old artery as well, like you'd imagine it would take quite a bit to cause some trouble like that you would know if you'd damaged it. That's kind of fascinating, and even in itself. Everything so far is fascinating in itself.
It really is. And, you know, looking back, it doesn't even seem real. It
No.
really doesn't seem real. It's like, that was my life. This is my life. And so recovering from that and then having the mastectomy, having it being my larger side gone, being flat for almost 3 years
Mm.
because I didn't get cleared until 2019 because of the mini stroke that I had in 2018. So then when that cleared and I got cleared to have the surgery, then they put in expanders. And again, we didn't have the immediate reconstruct when I had the mastectomy because they found cancer in my lymph nodes. So I was stage 2. I want to make sure to get that in there as well. Stage 2, um, breast cancer, ER positive, HER2 negative. I had to undergo radiation therapy. So with the radiation therapy, I had to do 4 weeks, 5 days a week of radiation therapy. And it was very, very traumatic for my body. They didn't prepare me. I don't feel that I was prepared enough for what I was about to experience.
So the radiation therapy, I'm going to ask stupid questions now. Is
No, that's
that
okay.
a therapy that's given via needle, or is that a therapy where you're in a device where it's like a scanner device type thing where it's is it the second one?
So when you walk in, Jennifer, you almost feel like you've been abducted by aliens because
Oh,
there's this,
really?
I'm so serious, there's this huge machine that you lay down and they have, for me anyways, they had molded a plastic type area or looked almost like plastic, but an area so that way the laser would just focus on this specific targeted area
Oh, it's
and
like a
block out
mesh kind
other
of a
areas.
frame, is it? I think I've seen like a mesh frame on someone's throat getting that done. So, but it's built for you specifically.
Yes, I had to, they went through like a training for us, for me,
Mm.
and I had to put a piece in my mouth for breathing as well, because there's certain time we have to inhale, hold,
Oh, yes.
okay, now exhale. So, you know, they did prep me on that. But
Yeah.
what I didn't get prepped on was how my body really was going to change in that. So
Okay.
when the radiation started, you don't feel anything. It's the aftermath of several treatments. And so as the treatments went on, I noticed my skin started to look almost like a sesame seed bun. It was like speckling, like speckles. Then it looked like, I try to give analogies so that people can, you know, really grasp this, especially if you've never experienced it or if your
Yeah.
experience was different. Then it looked like a hot dog that was placed on a barbecue grill that was on there too long, and it started to split, get hard, blacken, and peel and fall off. That's what happened to my skin.
Really? Terrific.
Yes.
And they didn't tell you about that beforehand? Because I kind of want to know that. That sounds.
No, no, I had no idea that that's how my skin was going to respond. And so I'm seeing this over time that the skin is getting very dark in that area. It's starting to get brittle, and literally, as I'm showering, it's going down the drain. It's flaking off and going down the drain. And I just will never forget those moments. And then I had to have an antibiotic cream
Mhm.
to put in that area to make sure, because it started getting raw, and to make
Yeah.
sure that it wouldn't get an infection. Here's the other thing that I was not prepared for. I took a lot of selfies during that time frame,
Yeah.
beforehand and during, so that I can have a tangible memory of the process.
Yeah.
When I was looking in the mirror doing one of my selfies, so I was doing like a selfie and a selfie, where you
Yeah.
turn your back to the mirror and then you selfie from the front, right? I noticed on my backside, directly opposite, it also was discolored.
So it goes. Well, I guess it makes sense when you think about it, but I wouldn't have thought about it. That's just the thing. So it goes all the way through.
Yes, yes. And I wouldn't have thought that either. So, because again, that there wasn't something that was in the fine print. When they go through all the, this could happen, that could happen, this could happen, none of that was in that,
I
in
guess
that dialogue or in the writing.
these are the day-to-day things that you'll be dealing with as opposed to the medical professionals when you go in for appointments and such. So to me, that's hugely important for the individual to know, because you'd be horrified if you're not prepared for it. I'm sure you were horrified if you're not prepared for it. I'm glad I know. I hope
Absolutely.
I never need to practically need that experience, if you know what I mean, but I'm glad to know about it.
Yes.
Uh,
I hope you never have to experience it ever as well. I don't fault the medical professionals because, they go over this so many
mm,
times, and it does become kind of routine, if you will.
yeah.
And the tragedy of that is when the person on the other end, i.e., me, comes in, this is my first time.
Yeah.
It's not my 100th time. It's not my 1,000th time. It's not my 20th time. It's not my second time. It's my first time. And so, as medical professionals, we need to get into the practice of approaching and having the bedside that this is this person's first time. It may be my 1,000th, 100,000th time that I have shared
Mm.
this with someone sitting on the other side of the desk, but this is their first time hearing it. We have to be more mindful and compassionate in that way.
I imagine from a medical perspective, medical professionals' perspective, like I would assume, and I don't know because I'm not a medical professional, that they're taught somehow to distance themselves from their patients, especially if they have to give them, bad news or updates and things like that. But I think there's also room for that, bedside manner, human aspect, like you say, especially if it's somebody's first time somewhere, or even combine that service with the person who's dealing with all of the clinical information with somebody who's able to translate that to the human that's sitting in front of them. We talk about that in tech all the time. Like, there's no point in telling people about technical things if they don't understand it. You need to do it in a way that they make sense of it. And there's nowhere more important than that than on the medical side. Empowerment.
Absolutely.
Yeah, you need to
Yes,
feel
a
empowered. Like,
100%. Absolutely. Yes, it does have to. And yes, there is that separation where, we're not going to cry with our clients now. Well, once they're gone, there may be some tear shed,
mm,
but, we want to be there for them. And, and at the same time, there still has to be that compassion there.
yeah,
Those moments
absolutely.
where we make the room such that the person can really authentically feel what they feel, and we
Yes.
support them in that.
Yes, because you're obviously a practitioner as well, and we're going to talk about that a little bit more in a minute once we go through. I guess I want to see you go through your story to that point at which you come out the other end of it.
Yes.
Um,
Yes, and there
So
is a happy ending, y'all. So
yes, we're
so
getting
so
there.
let me
We're getting
fast
there.
forward a little bit. There is a happy ending. It's coming, and it's still coming as we speak. But I'm on the other side, right? I can see the promised land,
Yeah.
and so fast forwarding, healed up, got cleared, undergoing reconstruction, had the expander placed in, and unfortunately, the area, so I did what was called the latissimus dorsi flap. So I had a portion of my latissimus muscle from my back spliced, flipped around to the front to make a pocket because also, and accompanying skin, because during the radiation therapy, my skin thinned out. They had to wait for it to thicken up a little bit, but they also wanted to fortify, if you will, with the skin from my back, as well
Mhm.
as the muscle, because as I stated, with the radiation therapy, the pectoral muscle was also compromised.
Yeah. Fair.
So all of that. And unfortunately, the area where it was adhered started to open up with expansions. So I had to have I know, right? So I had to have a revision, and they cut that area out and mended it. But then we had to expand slower. Well, because we had to expand slower, they had to access the port more often. The
Mm.
ports are only meant to be accessed a certain amount of time, and then it started to weaken. So I sprung a leak.
Whew. And is that
Yeah.
exactly what you just said? What does that mean?
So yes, I sprung a leak, meaning that the area where they would insert the needle to put in the saline solution to expand the area, it sprung a leak. It started to leak.
So literally sprung a leak.
Yes, literally that port sprung a leak. So we were going to have to remove it. Well, that was January 2020. I think you know what's coming around the corner. So they tell me,
Mhm.
well, we have an appointment in April. I'm like, listen, I am not about to have this leaky expander in me for 3 months. Get me a sooner date, please.
Yeah.
And they did. So let me pause for station identification right here. This is where we have to advocate for ourselves.
Yes.
Advocate for yourself. So I'm so glad I did, because I had the surgery on March 9th, 2020. The week later, on the 16th, I went back in for my post op. The very next day, they shut down all surgeries because of COVID. COVID shut the world down on the 17th of March here in the US. And so I wouldn't have had that surgery in April.
So close. I remember the 17th because it's St. Patrick's Day here. So obviously we'll remember it. We shut it down, I think, the day beforehand. So people weren't out doing parades on St. Patrick's Day. So I was smirking because I'm like, oh my God, I can see it coming. And you were so close to that timeline. So close.
Yes.
Were you okay then with it from there? Did you have any more leaks or any more issues?
Well, what they decided to do is, because I was so close to the ideal size that I wanted, they
Uh-huh.
put a placeholder implant in with the with the plans of having the next surgery to line the girls up. That's what I call it. Well, that next surgery didn't happen because COVID shut everything down. So I had to wait and wait.
You're the
So
queen of waiting at
March
this stage.
22, or excuse me, in 2022, I said, okay, you know what? I feel comfortable going back in now into a hospital type setting. And so they said, okay, we have March 23rd of 2023. I said, well, I like that date, 032323. That
Yeah.
must mean something. I said, okay, great, let's go. So, okay, I'm ready. I get to the hospital. The surgeon marks me up. They put my cap and gown on. I call it a cap and gown because I'm going to graduate to the other side of surgery. I'm ready
I
to
love
go.
that.
And they said, okay, well, you know what? All we have to do is COVID test you because you're going to stay overnight, and then we'll wheel you to the back. And I said, okay, great. So I think you know what's about to happen. The nurse comes out. She has this look on her face. And all I was like, nope, no, 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 no. She says, I'm so sorry, but you had to put your clothes on. Your test came back positive. You have COVID. And I said, wait, hold on. I've thrown a false positive before. Just retest me and you'll see that it's not true. And you're like, sorry, we're not going to retest you. We can't. You have to leave.
So you're this close. And will they bring you back in then, like a week later when your COVID is gone?
No, so there's a waiting period. And I don't recall, I think it was 21 days. Yes, it was 21 days you had to wait. So here's the fun fact.
Mm-hmm.
When I arrived home, the next day I took a home test. I took three home tests. All were negative. I went to the health department, negative. So
No
it
way.
was another false positive. still had to leave. This is ex post facto, right? So this is after the fact.
Mm.
So they scheduled me for May because that's the soonest date they can get me in was May. Okay, great. 10 days before that surgery, I actually caught COVID for real.
Like, I'm laughing at the ridiculousness of it. Like, you can't make this stuff up. It's like a potluck that's only full with crappy luck.
It's like Murphy's Law was on steroids in my life. It's like,
But you
what?
keep going, though. I'm like, this determination is fantastic. She keep on going. She's not stopping at any point and going, "Feck everybody, I'm just going to stop here." Kudos. Like, yeah, well, I'm impressed with that. So, okay, you keep going.
Yes.
And it's like a story with, yeah, I'm like, and?
And so they rescheduled me for August 14th and it did go through. But
Oof.
between the times, third time's a charm, right? But
Yeah,
between March to August, I was a wreck.
of
So
course.
I'm a mental health therapist, and a life coach, an executive coach. And so the thing is that when you go through these types of things, none of those acronyms behind or in front or wherever, none of those things saves you from experiencing what you experience.
Yeah,
None of that kept me from having that emotional roller coaster ride that I was going through. Started having panic attacks, the shortness of breath, the stomach upset, the palpitations in my chest, crying spells, all of those things from March, from having that surgery. I called it snatched. I literally was in and out of work because there was times where I took time off and said, you know what? I can't sit in front of someone and help them with the issues that they're going through with what I'm experiencing right now. I'm going to be all in my head. So I
yeah.
need to heal. And I gave myself permission to heal. And it wasn't easy. Let me tell you how easy it was not. When I had the first stroke, they kept me overnight because the first one wasn't as bad.
Mm.
They kept me overnight, ran some tests, and they said they'll do the rest of the tests outpatient. They sent me home the next day. The day after that, I went back to work.
Stop making me laugh. I sound like such an unsympathetic person, but I'm laughing at the ridiculousness of it. But obviously, you felt you could,
Yeah. And my
even
boss
though
even said
that
to me
blows my
at the
mind. Like,
time,
yeah,
yeah, my senior, he even said to me at the time, he says, why are you here? Because I had to give him the paperwork. He's like, why are you here? You just had a stroke. I said, I'm fine. I'm okay. I can do what I need to do. Later that night was when I had the second stroke.
because you weren't fine. You just weren't
I
accepting
wasn't
it.
fine. So we go, we do. As high performing women, we go above and beyond, even at the sacrifice of our health,
Yeah.
because we feel like we're fine.
Hmm.
And even in cases where we don't feel like we're fine, we still portray that image because we don't want to seem weakened in some shape, form, or fashion. Because as women, we're already a part of the minority in certain workforces as a whole.
Yeah.
And then as an African American female, feeling like I have to do that much more, have to be twice as good just to be considered equal.
And then you're a
Side note,
doctor
that
as
needs to
well, which
change.
is even more rare, I'm sure, that there's expectations about because you're at an educational standard or you run your own business and things like that, that therefore you must show everybody else that not only can it be done, but it is easy to do. And I'm grand, I'm fine, not a bother. It's crazy.
Yeah,
Really
we
crazy.
literally get hit by a Mack truck and then just dust ourselves off and keep moving.
Yeah.
But what that does is when we don't take the time for ourselves to really heal internally, and I'm just not talking about our internal organs. Well, I guess I am the brain, right?
Yeah.
So when we take time to heal ourselves and recover, that's when can really infuse what we have experienced into life lessons learned, and then we can infuse that into our leadership style. We can infuse that into our organizations. We can now help others and empower others to do the same, other high performing women to do the same. Listen, we don't have to have the cape on all the time. sometimes we have to take the cape off.
Yeah.
And when we surround ourselves with people, we have to let those walls down. Take maybe not the whole wall, but take some of the bricks out.
Yeah.
So that way people can see some of our vulnerabilities so that they know that we do need the help. Because a lot of times, as high performing women, people feel like, oh, you got this. You good.
Mm.
Oh, Dr. Michelle, she's always good. She has it. She's always Miss Super Fantastic. She's always Miss Transformed. So, I say that because my company is Lift After Breast Cancer, and the acronym LIFT stands for Living Inspired, Free, and Transformed. And so with that, people see you up here, but they don't see that we're still human. We still have feelings. We still have emotions that are real and authentic. And part of that challenge doesn't come just from them. Part of that challenge, we have to own it ourselves.
Yeah.
We have to let them know that, we're not, okay, I'm about to date myself again, y'all. Small Wonder. The show Small Wonder where she's, a robot, but she was an android and she
Yeah.
looked like a real person, but she was not. We're not androids. We are real people. Yes, we perform. And yes, we do it at a high level. But on the inside, we're still people. We're still human. And so we have to allow others to know that. So that way they can feel like it's welcomed to even offer help.
Yeah. Absolutely
And
right.
when we talk about companies, companies also have to do a better job. Corporate social responsibility. They have to do a better job of making people, or I'll say this, I won't say making people because you can't make anybody do anything, but providing an environment where people feel comfortable letting their mask down.
Yes.
And it doesn't have to be to the whole workforce, doesn't have to be to all the teams, but there should be something set up where someone can come in and talk to that department about their issues. And I'm not just talking about when they have mental health services that you can contract out for that. No, I'm talking about on site.
Mm.
Because what if that professional is having symptoms in the midst of doing their job?
Mm.
Who can they go and talk to?
Yeah.
Is it allowed for them to say, you know what, I need to take a half a day? Or will they be penalized? So there's different types of strategies that can be integrated into the workplace that can also help people like me, breast cancer survivors, to thrive in the work environment.
Absolutely. You mentioned Lift After Breast Cancer, which came after your experience. Where did that idea, how did you get from what could have been a hugely negative experience and turn it into something as inspirational as that?
Absolutely. You know what, Jennifer? When I was in that pause from March to August of 2023, I had a lot of time for reflecting, introspection, and speaking with people who would help me through my journey, i.e., my pastor, my parents, my family, some of my friends, close friends, and medical professionals, right? The medical professional team and my oncology social worker. So yes, I was receiving mental health services. It's so important. Listen, if you have a mental health therapist and she doesn't have a therapist, you need to run. If you have a life coach and they don't have a life coach, you need to run. If you have an executive coach and they don't have somebody who's, put it like this, if we think of all of the Michael Jordans, the Kobe Bryants, the Shaqs, they all had a coach.
Yeah.
As great as they were. So yes, I had guidance. And so that gave me the opportunity to really take what I learned. And I've always been that kind of person, really, that I love people and I love helping people. I love seeing people get that aha moment and seeing that light bulb turn on for them and helping them down the pathway. I've always been that person. Maybe another time I'll share a story about when I was 6 years old.
Okay.
I'll give you the short of the long. The short of the long is when I was 6 years old, I was in first grade I put a sign on my desk after Lucy and the Peanut Gangs. I put a sign on my desk saying that people could sharpen their pencils and get advice for 5 cents. Now, I don't know what kind of advice I was given. I don't know what kind of advice they needed, but my teacher contacted my mom and told her that kids were lined up at my desk, even though they had a pencil sharpener in the classroom. They were lined up at my desk because they wanted the advice. So I don't know. So at 6 o'clock,
I
I'm an
love it.
entrepreneur and wanting to help people. So that's the short of the long.
The early
So,
signs are there.
and so with that, now every experience that I've had, I've and I have to also attribute this to my parents and to my mom, who always stated that, once you find out what the problem is, resolve the problem. And with that, reach back and now I can help somebody else. So once
Mm,
I've solved a problem, I may put that in quotes because there are some challenges that are perpetual, they are ongoing. But at least you get to the point where you feel as if you can see above to now be able to reach back and help someone else. And that's something that I've always loved doing, is reaching back and helping others. So this was no different. Now this just gave me the more experience. So, we have experience, we have expertise, and we have education. So you see
mm,
the acronyms behind my name, you see all that, right? So I have a bachelor's in psychology, I have a master's in social work, and I was recognized in entrepreneurship and business administration for my doctorate. So I have all this stuff, but there's also experiences that I've accumulated over this vast many of years that I've been on this planet, including having a special needs son. He was born with cerebral palsy. I had a condition called vasoprevia with developmental cord insertion. Won't go into all what that means, but basically it's just a, oh my goodness moment, right? But fortunately, they found out about it when I was 3 months gestation. So I was on bed rest for that period. But that helped to set me up. Some of the other complex traumas that I experienced as a teenager, that helped me with experience. Going through some other adult type experiences, that helped to set me up. And I'll just name it. We're on the cusp of breast cancer awareness and also domestic violence. So yes, experiencing domestic violence as a teen in relationships throughout some of my other relationships. And so having all of that, and then strokes, and then breast cancer, and then I actually caught COVID. So all
mm,
of these life experiences that I had, I'm now able to wrap that up with my education, with my expertise, being a practitioner for over 20 years.
mm,
And now I can infuse that into reaching back and helping others by way of Lift After Breast Cancer, by way of speaking engagements, by way of coaching programs, by way of community. As a matter of fact, we have an event that's coming up on October 12th at 12 p.m. time. It is our inaugural Breast Cancer Awareness Symposium, where we're going to have speakers who are from practitioners, from survivors, caregivers, supporters. So we're going to have dynamic speakers from all perspectives who are going to be speaking about their personal experience, whether they have been on the treating end or the receiving end, or the supportive end and the caregiving end. And there's also a young lady who's going to be speaking, who's going to talk about some cutting edge technology that's going to help us drive cancer care, breast cancer care. So it's just going to be absolutely, absolutely amazing. And so I hope that you all will be able to tune in, and I hope, Jennifer, you'll be able to tune in
yeah.
because it really will be dynamic. And I'm excited about it. This is our very first one, and it's strictly virtual. I've done 2 other awareness symposiums, which was Women's Health Symposium we did last year and this year. And also as a part of some of the programming that we've done to give back. Because when I experienced what I experienced on 02323, I started writing in October a article a day on LinkedIn. And it was chronicling my cancer journey, my personal journey with cancer.
Yeah.
So you'll hear me say my personal journey with cancer or my cancer journey, but you'll never hear me say my cancer. It was not my cancer.
Mm,
It was something that visited me unwanted, unwanted visitor who was just passing through and prayerfully will never return, right? No frequent flyers. So,
words are
and
so
that's important
important
because
around
words
that.
matter.
Yeah. Very much you just said, yeah, words matter, like, and
Words
it
matter.
affects how you own things or not. I think the words that
Exactly.
you use. Yeah.
Exactly. And if we can just digress for a quick moment,
Yeah.
I also want to put in there, because of the fact that I had this love-hate relationship, if you will, with my breast. We have to be careful with how we channel our energy.
Mm.
And I had such negative energy surrounding my breast that it really wasn't a surprise that it would manifest itself in some way.
Mm.
I just obviously never knew it would be breast cancer. So I want to put that out there for people so that
Yes.
they understand that thoughts are things and words have power. So be careful what
Absolutely.
you think. Be careful how you emote.
And
Be
in the same
careful
way,
with those
negative
things.
energy is so powerful like that. In the very same way, positive energy can be as powerful too. I know I've often found over the years worked a lot on what's happening, what the thoughts that are happening in here and how I'm speaking to myself, shall we say, and then turning that into a more positive conversation. And it's powerful, the difference when you start thinking differently and using different energy, the difference in how the world looks when you do that. So I could only begin to imagine the things that you can create and do with positive energy versus the damage that can be done by negative from there.
Absolutely, absolutely. And so what I was able to do with that date, I call it the date of devastation. I was able to transform that into celebration. As a matter of fact, what that turned into was a celebratory brunch for breast cancer survivors and supporters. It was our very first celebration, elevation, transformation brunch that we did 1 year later to the date. So this on March 23rd of 2024 was when I had that brunch. So I literally was able to package up that devastation, turn it around, transform it into celebration, and then give it out to others.
I love it. I love it. What a wonderful tale. I'm so glad that in the middle we were going, we're getting there. We're getting there. We're going to come out of this and it's going to be good because it is. It's a fantastic way to wrap it all up. And we're in obviously Breast Cancer Awareness Month. And it's such a fantastic story and such a fantastic outcome that people can be involved in because, like you say, it is remote as well. And I'll put links in for the video for anyone that wants to get in touch. Is there any kind of final words or thoughts that you'd like to share with people before we close off, I guess, today? Because I could listen to you all day. Everything is inspirational.
Absolutely, absolutely. I would say that it's okay to heal out loud. It's okay as a high performing female to heal out loud. Make sure that we surround ourselves with people with positivity and people that can understand our journey, whether it be because of the fact that they've experienced it themselves. So having a community that we can really let our hair down or take it off, whatever the case may be, with people who understand our journey, surrounding ourselves with our medical team and getting their professional opinion and also advocating for ourselves. In the workplace, making sure that we are taking in what is available, but not allowing that to be status quo. If it's not enough, say something, do something. Be a part of that change. Be a part of that. Be that catalyst to be that change. If you don't know how to do that, connect with me. I can help you. I can help you. So surround yourself with people who are going to support you. Take time for yourself. Self-care is not selfish. It's not an elective. It is mandatory. And actually, let me take that back. Self-care can be selfish. It's called do you because you deserve it. So be selfish. Put yourself first. Allow yourself to fully heal and recover. So that way, they're not just getting the rest of you, they're getting the best of you.
I love
That
it.
would be my suggestion.
I love it. Thank you so much, Michelle. It has been an absolute blast. We'll share the links, especially for the 12th. Isn't that what you said?
Yes, yes. On the
Yes,
12th,
we'll
right around the
share the
corner.
links to that. I look forward to it and we'll see you there. Thank you so much for your time.